Hey, what's going on, y'all? It is another Monday night here on the Masked Up Community Health live stream, and I am Andru Defeye, aka the Gorilla Poet Laureate, aka the Hoodie God, aka Spittin' Quarantino, aka I wear my sunglasses at night indoors because my eyes are as sensitive as my heart is. And I hope we are beaming into your feeds, finding you and yours healthy and full of joy on this Monday evening. This is Masked Up, like I said. As always, I will be joined by some thought leaders tonight, including Upstream health aficionado, Dr. Rishi Manchanda. Yeah. And infectious disease expert, Dr. Tara Vijayan. Yeah, keep it going. Keep it going. Yeah, and as always, shout out to our partners that protect us. Made a little bit of news this week. Y'all see this? Y'all see this yet? Dr. Pan, Senator Dr. Pan, addressed Robert F. Kennedy Jr. getting his Instagram taken down permanently this week. Senator Pan said in an email, "First off, run the test. What clinic you claim? West Side when we..." Okay. No, he didn't. No, he didn't. He did not say that. I just come from hip hop, so I hear everything in battle rap. What Dr. Pan did say in his email on Wednesday was that Kennedy should be stripped of all of his social media accounts for using them, and I quote, "to spread lies about COVID-19 vaccines and trying to drive fear in communities of color." Kennedy responded by calling the campaign an attempt to quell debate and saying the idea of a government official advocating for censorship of Americans for criticizing a pharmaceutical product is anti-American. Now, what he said is a valid statement. But as we learned last week, it's also a false equivalency. Instagram banned you, my guy, and it's Instagram. You know what you have to do to get banned from Instagram? So y'all know we believe in open debate on this show. So we at Masked Up would like to extend an invitation to both Dr. Pan and Robert F. Kennedy Jr. because as we all know, rap battling is the ultimate form of debate. So it's really the only way that makes sense in this context. You know what I'm saying? So I'm just saying, Dr. Pan, RFK Jr., coming soon. Rap battle of the century. Doesn't Dr. Pan look like he's about to drop the hottest album of 2021 right there? I'm just saying. I don't think RFK wants that smoke. Like I said, I got Dr. Rishi Manchanda and Tara Vijayan joining us tonight. If you've been watching for a while, you might remember we actually featured Dr. Manchanda's TED Talk as our first Netta Found This content.
It was that we put in place a system that allowed us to routinely ask questions like Veronica and hundreds more like her about the conditions that mattered in her community, about where health and unfortunately sometimes illness does begin in places like South LA. In that community, substandard housing, food insecurity are the major conditions that we as a clinic had to be aware of. But in other communities, it could be transportation barriers, obesity, access to parks, gun violence. The important thing is we put in place a system that worked. It's an approach.
So I'm here to tell you, we have come all the way up, y'all, and it's due to you liking, sharing, and tuning in to this here live stream. Because back then, we were just playing them on YouTube. But tonight, we got him in the studio, y'all. Dr. Rishi Manchanda. Hey, Dr. Manchanda.
What do I do?
How you doing? How's your quarantine been?
Hanging in there, man. How about you?
Same. Doing the best that I can today. Hunting the joy wherever it is.
Hunting the joy. I'm gonna borrow that, my friend.
So, as you know, it's a big deal for us. You know, we've We've got you here in the flesh. We started out just having you on the YouTube, and now we've got you here in the flesh. In the TED Talk that we use, you say medical care is just one of the components that shapes our health, but that we need to look upstream to what makes us sick in the first place. What are other important contributors to our societal and individual health?
Yeah, thanks, Andrew. First, thank you for again just having me on the show. I'm joining many other fans out there of yours, so and I can't thank you enough for the public service that you're doing just through these forums and the kind of engagement. So thank you for having me. It's an honor to join you. So Upstream, what does it mean? In the TED Talk and in general in my work, I often tell the Upstream parable, but I tell a version of it that folks may not have heard before. For those who haven't even heard the parable, let me tell it to you this way, and then hopefully this becomes your default. In the story, there are, imagine 3 friends who come to a river. In the river, they realize that there are people, there are children, adults, the elderly, and they're not leisurely swimming. They're actually struggling. The tide is really strong. They're being rushed towards, in fact, a waterfall. So they're in peril, and they're crying out for help. The first friend, all 3 jump in. They do what a lot of people do in both healthcare and in social services and human services and in life in general. Most of us do what these 3 friends do, which is to jump right in and help. First friend says, I'm a really strong swimmer, so I'm going to go to those folks who are they're about to fall over the edge of the waterfall and rescue them. One by one, I'm going to try to save those lives, the people who are most vulnerable, most acutely at risk. And now the rest of us who have gathered along the banks of the river say, yep, that person is doing the right thing. Let's applaud that person. Let's give whatever resources this person needs, whatever she needs to be able to rescue folks. Let's help that rescuer. After a minute, we see the second friend who's doing the same thing, saving people. But she recognizes something interesting. She says, if I gather these branches and these logs across the banks of the river, and I get some twine and I put these all together, if I coordinate these branches together, I can build a raft. And as I build this raft, I can usher maybe 20 or 30 people. For every one person that my rescuer friend is helping out, I can save 20 or 30 and get them to safety at the edge of the river. The rest of us now say, well, that's a smart idea. That's great. What resources can we give you? That makes total sense. So now we're seeing these 2 friends in the water. And so far what we've described is the story of American healthcare, the conventional story, the story of the rescuer, right, and the raft builder, the specialist, the ICU nurse, the trauma surgeon, the oncologist, the people that you want when you're in dire straits, right? When you're acutely at risk of having an illness, a trauma, a sudden urgent issue, a crisis medically that we need help with. No doubt we need them. We also know that we have the raft builders, the primary care clinicians, the care teams, right? The nurses, the doctors, the physician assistants, the medical assistants, the community health workers, who are part of that raft building exercise to get more people the help they need so that they don't end up actually at the waterfall's edge, so they can stay as healthy as possible. That's the story so far of American healthcare, and it's a really good story. It's a really good model. The problem is that in this story, in the parable, these 2 friends, they do what happens in a lot of rivers across America. They show up day in, day out at that river to help. The rescuing continues, the raft building and the rafting kind of continues. And sometimes our friends get fatigued. They say to people in the water that they're saving, they say, look, it's you again. Didn't I save you last week?
Mm-hmm.
I mean, didn't your mama teach you how to swim? I mean, come on now, right? Out of their fatigue, out of their the cognitive dissonance, they don't really understand what's happening here. Why are these people still in the water? What's going on here? They start getting burned out. And sometimes they even say really ugly things to the people they're there to help, right? They say hurtful things sometimes. The biases come out, the ugliness comes out, and sometimes we turn on the people we're trying to help to explain away our own dissatisfaction with a broken system. Mm. But more often than not, our healthcare and other service industries, right? People, raft building rescues continue, and it's noble work. And in this story, the 2 friends recognize, wait, there was a third friend who jumped in with us. Where is she? And they finally spot her. She's way further upstream, and she's saving people as she's going, but she's swimming away. And they shout to her, yo, what's going on? There are people here to save. And she shouts back, their third friend shouts back and says, I know. I'm going to find out who or what is throwing these people in the water. Mm. The story of American healthcare has always included, it turns out, that those 3 friends, the practitioners, the professionals, the committed individuals who sometimes have even sworn an oath to help, to heal, to serve. And oftentimes find that it's not just about the rescuing and the raft building, but we also have always had people in our midst, people I call the upstreamists, right, who are trying to help people, trying to help all of our teams, our care, our clinics, our hospitals figure out who or what is throwing people in the water. The upstreamists are the ones who build bridges with public health, build bridges with housing agencies, with food systems, with upstream partners in the law, even to think about how we can fix what's throwing people in the water in the first place, what's making people sick in the first place.
Right.
And we need that. And what's making people sick in the first place, to get finally to your question, right, directly, what are these upstream factors? Well, they include all of the things outside of medical care. For example, where we live, work, eat, sleep, and play, the living and working conditions in our communities, whether, for example, there's a food desert that you live in, where that in one geographic area, there's just no access to buy affordable, healthy food, right?
Right.
Or you live in an area that's been historically redlined, and so access to affordable housing and other opportunities like access to parks or public amenities like the post office or a good police department or local social services, like all the things that you think are part of a decent community. If you don't have access to that because this community has been historically redlined, well, that's defining the living and working conditions. So the upstream factors are all the social, economic, and political conditions that shape health in the first place. And it turns out those factors have more than 5 times the impact, at least 5 times the impact on how long we live and how healthy we are than all the pills and the procedures that doctors can provide. And so as a doctor, what I found in my life is, how can I now better connect my work as a caregiver to the work of finding out what is actually throwing people in the water? And that's the work of being an upstreamist. That's the work of moving upstream.
So what does upstream medicine and kind of the upstream theory look like in terms of something like COVID-19?
Yeah, well, I mean, COVID has done what a lot of infectious diseases have done throughout history, which is to exploit and reveal the deep inequities that exist in society, right? There is no surprise to any expert in infectious diseases or in healthcare or in the social sciences, right, to see that COVID has disproportionately infected and harmed and killed Black and Brown communities in America. And it's not because of any intrinsic kind of genetic differences. It's not like that race explains it, it's that racism explains it, right? Mm-hmm. It's because of it's not just, and I don't mean racism in terms of interpersonal racism, like if you're biased or prejudiced. I mean the racism at a higher level, which is institutionalized, or what people call structural racism, right? Whether we're seeing it play out even with the vaccine issue, but it played out even early in the pandemic when we were talking about testing, right? Or we were talking about access to medical care in the first place. At every step in this pandemic, we've seen that, whether you have good access to healthcare, whether you actually are in an environment, whether you're in a job which puts you at a higher risk of getting exposure to COVID, right? Whether you're in a job or in a community that has easier access to personal protective equipment, masks and whatnot, whether you're in a country that is going to provide you with the economic vaccine, right, to inoculate yourself against the harsh economic kind of impact that this had on people's lives. Time and again, what we see, in other words, is COVID has revealed the fact that it's not just health equity that we have to care about. We have to understand and address the social and the structural drivers of health equity, because that's what COVID has taught us again and again. And the last thing I'll say is that, thankfully, what we're seeing now more and more over the past year, and especially the past few months, is more and more people at the highest levels and in communities front and center, whether it's in Sacramento or in LA or in any parts of California, we're seeing more and more leaders understand that equity is the only way to be effective, right? We can't just care about equity when it matters to a certain, for a certain, when it's campaign time or when it's time to kind of talk a good game, but really kind of move on to other business. Equity is the only way to actually effectively mitigate the impact of this pandemic, and frankly, to not just recover from this, but to reimagine what society needs to look like.
Mm. I always say that equity isn't a conversation; it's the beginning of every conversation, and needs to be. Um, all right, so I mean, thank you so much for shedding some light on all of that for us. The question now, I have one more before you go, because this is the question that I ask everyone that comes on this show.
Oh,
Where's your joy coming from?
I like that one. Okay, I was wondering if there's going to be a curveball in there, but that one.
Oh yeah, this is my gotcha.
I'll take this gotcha any day. Where's my joy coming from? It comes from the people I love and the people I have the privilege of working with. People I love. Yesterday was my wife's birthday. I had a chance to last year, pre-COVID. I was working and life, and we've got our kids and all that stuff. But I mean, this last year, the humbling experience, right? The gravity of what's happened this past year, and also the reality of being able to actually have to just figure out how to spend time with people, more time than you otherwise do. The fact that I'm working from home more often than not means that I'm spending more time with the people I love. And I've had on the flip side, the silver lining that I've been able to kind of celebrate people I love. And yesterday, because of your background in poetry and in music, you'll appreciate this. I worked with an artist, and we got a song together for my wife's birthday. And
Wow!
Yesterday, 3 minutes, and man, it was just joy. Just kind of see the smile on her face to see this music. So I got the joy of actually watching somebody actually start to tear up because of the power of music, and it was lovely. So that's where my joy came from. Just it's fresh of mind right now, and the people I work with is the other part of it. I get to work with people across the country who are moving upstream every day. Leaders in hospitals and healthcare systems, leaders in public health agencies, leaders in communities who are fighting not just against the pandemic, but fighting against injustice. And man, the energy, the joy that I get from doing whatever I can to help elevate their voices, to support their work right now, fuels me every day. So I get joy from people I love and the people I work with, and it's a privilege every day.
Right on. Well, thank you so much for joining us, Dr. Manchanda. It was more than we bargained for, because we were just here to talk about upstream medicine, and what we also got was how to keep a relationship fresh. You know what I mean? Y'all make sure that you talk to your artists, holler at your local artists out here. But man, thank you so much for joining us, and we'll have to have you back to talk more upstream medicine sometime.
Lots of love, man. Thank you so much. Be well.
Bless. Y'all, while we are here talking about upstream medicine, a new study released February 25th from Tufts University Health Sciences campus in Boston suggests a majority of adult COVID-19 hospitalizations nationwide are attributable to at least one of four pre-existing conditions. That's obesity, hypertension, diabetes, and heart failure, in that order. Let me run those back for you again. Obesity, hypertension, diabetes, and heart failure, in that order. The study, published February 25th in the Journal of the American Heart Association, used a mathematical simulation to estimate the number and proportion of national COVID-19 hospitalizations that could have been prevented if Americans did not suffer from these four cardiometabolic conditions. The researchers estimated that among the 906,849 total COVID-19 hospitalizations that had occurred in the U.S. adults as of November 18, 2020, 30% were attributable to obesity, 26% were attributable to hypertension, 21% were attributable to diabetes, and 12% were attributable to heart failure. Y'all, medical providers should educate patients who may be at risk for severe COVID-19 and consider promoting preventative lifestyle measures such as improved dietary quality, physical activity, and improving overall cardiometabolic health. It's also important for providers to be aware of the health disparities people with these conditions often face, said author Megan O'Hearn, a doctoral candidate at the Friedman School. At any age, COVID-19 hospitalizations attributable to all four conditions were higher in Black adults than in white adults, and generally higher for diabetes and obesity in Hispanic adults than in white adults. For example, among adults aged 65 and older, diabetes is estimated to cause about 25% of hospitalizations among white adults versus 32 among Black adults and about 34 among Hispanic adults. When the four conditions were considered combined, the proportion of attributable hospitalizations was highest in Black adults of all ages, followed by Hispanics. National data show that Black and Hispanic Americans are suffering the worst outcomes from COVID-19. Our findings lend support to the need for prioritizing vaccine distribution, good nutrition, and other preventative measures to people with cardiometabolic conditions, particularly among groups most affected by health disparities, said Dariush Mozavarian, lead author and dean of the Friedman School. Policies aimed at reducing the prevalence of these four cardiometabolic conditions among Black and Hispanic Americans must be part of any state or national policy discussion aimed at reducing health disparities from COVID-19, which brings us to the racism crisis. What? You thought just because Black History Month was over, we were going to stop talking about the racism crisis? It's just February 29th over here, y'all. While we're talking about COVID prevention and treatment, there is something else we need to talk about, and that is the fact that some of the very equipment used to detect coronavirus is biased toward our Black and brown family, y'all. So I found this video with medical student Joel Bervel and Brute telling us more about the racism hardwired into pulse oximeters and why that's important.
This is a pulse oximeter. It measures your blood oxygen saturation level and also helps guide medical decision making. But studies have shown that it doesn't treat all skin color equally. Because of differences in how the skin absorbs light, Black patients are more than 3 times as likely to have inaccurate, overestimated oxygen saturation levels compared to white patients. That means a patient is coming in, might not be able to breathe, but their pulse oximeter is saying they're getting all the oxygen they need. Much in the same way that racism exists in healthcare, education systems, and in legal systems, they can exist in the machines that we create. If you ask any Black individual, they've experienced it to some degree. I personally first heard about the story on social media when one of my friends shared it on their Instagram story, the article from the New England Journal of Medicine talking about the pulse oximeters. And I was shocked. One of the things I was thinking is, how many people know about this? And do people know about this? In my own life, I know it pops up when I use things like Snapchat filters. I can be in the same frame as a white peer and they will get the filter, but I won't. Facebook, sometimes they automatically tag your photos. I can't even tell you the amount of times that I have been incorrectly tagged as another Black person. Go on Google and look up something like professional versus unprofessional hairstyles. When you type in unprofessional hairstyles, the amount of Black individuals that will show up with natural hair is much higher than if you look at the professional individuals. And these are little things, right? But overall, they can make a big difference when you don't keep people of different skin tones in mind. We have to remember that machines themselves aren't biased, but the people behind the screens that actually make the machines can be. When we create a machine, it's our assumptions, our biases, our own personal beliefs that then are put into the machinery and become encoded within it. And there are designers and researchers and engineers thinking about this. The thing is, it's not an easy fix. If you don't have people that look differently in these spaces thinking about these issues, no one's going to bring it up.
Yo.
If the literature being trained
Yo.
as a child isn't entertaining.
So, first and foremost, I mean, that is wild, right? It's wild. Also, we want to give a special shout out to Allison, because Allison found that. We used it for the racism crisis, but undergrad, Allison found that and brought the pulse oximeter issue to our attention, which was wild to me. So I'm glad we got to share that. And y'all see how systems of white supremacy have tucked themselves into every crevice of our society, including all throughout the technology. You know what I mean? So shout out to Joel and Brute for bringing that to our attention, and to everyone working to be part of the solution to the health crisis known as racism. So we've talked a lot about COVID tonight. We haven't been for the last few weeks because everything's been going down. You know what I'm saying? But we have an infectious disease expert on the show, and I had all the questions. I let my social media channels know that she was coming by, and you all had questions too. So we're going to get to the bottom of all of that. Ladies, gentlemen, third gender, non-binary loves, our guest is an MD, an MPH, the medical director for the Antimicrobial Stewardship Program at UCLA Health, associate director for the Scientific Foundations of Medicine at the David Geffen School of Medicine, assistant clinical professor in the Division of Infectious Diseases at UCLA, and an incredible writer. I highly recommend her essay, Browner. It was super poignant and beautifully written. And you know I'm all about my words, y'all. Beautifully written while being highly educational at the same time. Y'all, give it up for Tara Vijayan. Dr. Vijayan, how are you today?
I'm well, thank you. Thank you so much for having me.
Absolutely, our pleasure. I told people that I was having an infectious disease expert on the show, asked if there were any questions they would like me to ask. Most of them were centered around vaccine hesitancy, including distrust in the vaccine's quick rollout, being sure how COVID-19 vaccinations will work in the future. Is it going to look like a yearly flu shot? I imagine that you, as the infectious disease expert extraordinaire, are hearing a lot of this right now. Is there any overarching message that you want to give to folks who are struggling with vaccine hesitancy right now?
Yeah, I mean, I guess first of all, I would say it's okay to be afraid. A year ago, I was terrified when this brand new virus came to our world, and I had no idea how to treat it. I will say that a year later, there are still things that I don't know, but there is actually a lot that we do know, and a lot of wisdom that we've gained in the span of now 12 months. And one of those things are these vaccines. And while the technology is new to us, it actually is technology that's been studied for a couple of decades now. These are things that brilliant scientists, way smarter than me, have worked on for a long, long time. And they took the opportunity to really look at this right when this pandemic hit. They were up and running. And, with the help of amazing human beings who volunteered to take part in these studies. So there are 3 studies that we now know of with the 3 vaccines that are out, each of which have had 30 to 40,000 people that took part in those studies. We've discovered this, 3 great vaccines that work. They work in preventing people from getting infected. They work people from getting sick enough to go to the hospital. And this is exactly what we need to get us out of this pandemic. These are our goals, to get people to try to prevent infection, to try to prevent people from getting sick enough to go to the hospital, and to try to resume our lives and get back to normal. So I'm really, really optimistic about the three vaccines that are out there right now.
So, as an expert in infectious diseases and a parent, how do you feel about getting kids back into schools while trying to mitigate the public health risk?
Yeah, it's a great question. I mean, I will tell you, I've been a big proponent of getting kids back into schools for a long time. And, we've had a lot of support from our pediatricians. The American Academy of Pediatrics has also really been strongly proposing to get kids back into school. Kids are not doing great on Zoom. My one kid who had to go on Zoom was really struggling, and he had all the resources in the world, right? I mean, we're very privileged. I acknowledge my privilege. I have an incredible woman who helps me care for my children when I'm at work. And despite all of that, it's really hard. They just aren't getting the same kind of education. They're not getting the same kind of social interaction. I will say both of my kids, actually, I have a 7-year-old and a 4-year-old, and they've been actually in a school setting since September. So my 7-year-old actually was basically going to what was his after school program, but it was there for the whole day, and he was able to do his Zooms there. And then in December, actually, my school district opened. Even though we were at the height of the pandemic, they opened, and they implemented all the right mitigation measures. All the kids have been masking all throughout. They're doing their distancing. They're doing all of the the high touch surface cleaning, and all of these things, honestly, have really worked tremendously all throughout. We've had no cases of in-school transmission at all. So I'm very, I really strongly believe that we're in a good place now with vaccinations rolling out, and hopefully we can get more teachers vaccinated as well, that kids should absolutely go back to school.
Right on. So one thing that a lot of folks have said since the beginning, you heard a lot of the flu cases are just being labeled as COVID for the past year. You said in a recent article that you haven't seen a patient with the flu since February 2020. Now, my question is, are you part of a government conspiracy, or did we get rid of the flu this year with our masking and social distancing? And if you're part of a government conspiracy, you have to tell me, otherwise it's entrapment.
Well, I will tell you, I'm not part of any conspiracy. I will tell you, I probably would get paid more if I were part of some conspiracy. You are welcome to look at my tax records. I have nothing to claim. But genuinely, I think that our mitigation efforts have dramatically reduced the number of flu cases that we've had in the last year. Flu does tend to affect different demographics. It does tend to affect children more than COVID tends to affect children. So, that probably has something to do with the fact that we're not seeing as much flu. But no question, the masking, the distancing, all of these things have helped tremendously.
Yeah, I know. I have a special edition immune system, so I generally have at least one bout with the flu per year. And I was just realizing I have not been sick since last year, like since getting into my social distancing. And I think that's for me, when I saw people making that argument online, they were like, well, they just turned the flu into COVID cases and did it. And it was like, well, I can tell you, I'm at least a -2 flu cases in the statistics. So it was really interesting to come across that article and see someone who works in the field having the same kind of observations that I was having. So you. And that brings me to the next point, right? The politicization of science. You recently wrote an article for BMJ about the politicization of science and public health interventions. So the big question that I'm just going to set on your shoulders and yours alone: how do we untangle science and politics?
It's such a tough question. And honestly, I think where I would begin is by sort of acknowledging that politics is not always humble. There's not a lot of humility in politics, but there is actually a lot of humility in good science. And by that, I mean that, scientists and physicians are okay with being wrong sometimes, right? And it's a process. And the more information we get and the more evidence we get, the more comfortable we feel in making certain decisions. If I sort of look back at how all of this has played out, you sort of look back at some of the treatment options that we've had available. So one of those treatment options that we were considering was a drug called hydroxychloroquine. Very early on, hydroxychloroquine became a politicized drug. Our former president was really touting it as a wonder drug. But then we had these great scientists who were willing to take the chance on testing this, even though they weren't sure if it would work or not. And they enrolled thousands of patients who were willing to take the drug, even though they weren't sure if it worked or not. And they discovered that it actually wasn't effective. And they were, and for them to sort of go out on a limb and trial a drug that has, ultimately had no benefit is, they knew that it was an important thing to do and an important message to get out and an important thing to publish. And so, I sort of encourage people to remember that when we're trying to do good science, we're not trying to win any favors. We're just trying to figure out what's the right thing.
Sage advice there. I love it. So I have one more question for you, and it is the question that we ask everyone that comes onto this show. Where is your joy coming from currently?
I mean, without fail, it's my 7 and my 4-year-old, hands down. When I put them to sleep, especially when they're sleeping. I'm just kidding. They're my joy all the time. But when I'm looking at them and looking at their amazing faces and realizing what the world has to offer for them, that is where I find my joy.
The wildlings, I think I saw them referred to.
They are my wildlings, indeed.
Beautiful. Well, half the internet watches this show every Monday night. So if you do you have any final words of advice for the half of the internet that will be tuning in tonight?
I would just encourage people to listen to the science, to find those people whose wisdom you believe in, and just try to keep everything honest.
Mm-hmm. Well, thank you for joining us tonight, for coming through and being one of our enlightening and enlivening guests here on Masked Up, and just stay healthy, and all the best to you and yours.
Thank you so much. I really appreciate it.
Y'all, you may have noticed that I was going to try and do the entire show without talking about Miss Rona, because I'm as tired of it as you are, and the numbers have been going down for a few weeks. But when it comes to Miss Rona, I need you to think about it like any heartbreak, y'all. Just because we want to be over her doesn't mean that we are, or that we are ready to be out and about with anyone else. You know what I'm saying? So NBC News this week dropped an article entitled "CDC Director is Very Concerned That COVID Cases Have Stopped Falling. As a lot of states' regulations are being loosened up, we may have hit a dangerous plateau amidst the pandemic fatigue." The NBC News article, shout out David Ingram, says the third COVID-19 spike may be leveling off high, a worrying shift in the trajectory of the pandemic. A top government official warned on Friday. Dr. Rochelle Walensky, the director of the Centers for Disease Control and Prevention, gave a sobering update about the latest data on cases, hospital admissions, and deaths in the United States. And she said the direction of the numbers may mean states should rethink plans to relax restrictions on in-person activities. Over the last few weeks, cases and hospital admissions in the United States had been coming down since early January, and deaths had been declining in the past week, but the latest data suggests that these declines may be stalling, potentially leveling off at a still very high number, she said in a briefing. We at the CDC consider this a very concerning shift in the trajectory, she said. It's not clear where the numbers will go from here, whether they will resume falling, plateau, or even spike again. But Walensky said her agency was watching the data closely. Now, the next day, a story dropped in the LA Times titled, "New Fears of Next Coronavirus Wave as Case Declines Slow and Variants Grow." Shout out Rong Gong Lin 2 for this one. Federal officials are expressing worry that the decline in daily new coronavirus cases nationwide is starting to flatten as one of the variants from the UK is on the rise. They warned states against relaxing COVID-19 restrictions, saying the nation remains at a precarious point that could tip into a fourth surge before more people get vaccinated. We are at that very precarious position that we were right before the fall surge, where anything that could perturb, that could give us another surge. Dr. Anthony Fauci, President Biden's chief medical advisor, you know who he is on the pandemic, told reporters at a briefing Friday. We don't want to be people always looking at the dark side of things, but you want to be realistic. So we have to carefully look at what happens over the next week or so with those numbers before you start making the understandable need to relax on certain restrictions. So please, y'all, please take care of your fellow human beings. Keep it double masked, take precautions if you are deciding to be out and about right now. That's all. I told you I wouldn't drag you down with the depression of the numbers as long as we were on a dissension, and I'm going to stick to my end of the deal. Y'all stick to yours. You know what I'm saying? And with that brings us to the end of another episode of Masked Up, your community health live stream. I'm Andru Defeye. Shout out to our protectors and our partners at Protect Us. And as always, thanks to Netta, Avani, Suchita, Allison, and the rest of the Masked Up show crew. From all of us to all of you, covered face, no case. Stay healthy, y'all.